Well, one of the things about, excuse me, listening to some of what Matt was talking about really just reminded me of a lot of the pieces that we're doing with suicide prevention. It's built moment by moment, right? So relationship by relationship and connection. And one of the pieces when they're connected across the states, all these efforts that you're doing to support young people, the impact really, multiplies, right? So as you were talking in your breakout rooms, you had a conversation with other folks from different counties and talked about some of the different pieces that you're implementing within your counties as well. And so we're going to start to kind of think about or discuss exactly what we did in the Youth Suicide Prevention and Response Network project. And we're going to explore some of the different pieces. You probably have already created some of the aspects within your community, but we're going to share some of these beautiful highlights that we were able to provide for this particular project. Next slide. All right, so there's a lot of words on this slide, but one of the pieces, this particular project was launched in 2022 and was funded by the California Department of Public Health. And we also partnered with the youth social marketer to support 10 pilot counties in the state of California. So really, as we began to build the Youth Suicide Prevention Response Network, our goal was simple. It wasn't an easy process, but it was very essential. Right, so we're going to take you kind of through our journey throughout California, and what we wanted to do is establish and improve and expand systems for these 10 pilot counties on reporting and responding to youth suicides and suicide attempts. So what we did is that we supported through consistent communication, collaboration, and really we were very intentional about the resource sharing, because we know that we can't do this work alone, right? So we really supported counties and really doing that cross-sector partnership. And Tina is going to really talk about some of that process that we helped to define and support the counties with. So we were able to meet counties where they are, and we developed a range of TA services and products, which included listening sessions, communities of practice, webinars, peer learning exchanges, intensive coaching. We'll talk a little bit about that in just a second. But we also were able to provide newsletters, publication, and practical tools to really strengthen their day-to-day implementation. One partner that's not listed on this particular slide was also UCLA. They were actually the evaluation branch of this project, who tailored 2 essential frameworks that Tina is going to talk about, as we were able to provide this intensive coaching to the counties. And all of this foundation really provided the opportunity for us to create the Youth Suicide Reporting and Crisis Response Pilot Program. I know the dates on here, it says 2022 to 2025, we just sunsetted the project. So in reality, what happened was that we didn't have 3 years to implement the project. We actually started late, right? And we'll talk about one of those challenges later on today, but the main piece was that contracting really took a lot of time for these 10 pilot counties to get started. So we actually technically had about 18 months to really dive into supporting these 10 pilot counties. So we'll talk about that in just a second. But I know you may also connect with some of this, the barriers with like contracting and some of these pieces that come along with really the implementation of some of the work with the state projects, or even within your own counties. You may have some delays because of just the contracting process that happened. But all to say that the core of the program was really to support all the young people, and regardless of where they are, where they live, really is providing that access to culturally responsive, compassionate, and effective support after a crisis. And so we were able to provide some of that aspect to support these prevention strategies, and also really supporting the reduction of the risk for young people as well. So in the next slide, these are the 10 counties that participated in the pilot project. And so as you can see, they're very spread out. So we have, folks from all the way to San Diego County to Humboldt County as well. And so how these particular 10 counties were selected, there was a criteria, and they were invited to participate in this project one of the main criteria was they had high rates of suicide within their communities. And part of the other piece too is that really supporting them and establishing and improving their local and response to youth suicides and suicide attempts by enhancing that crisis response process. And so these counties agreed to be part of the project and really witnessing some of the beautiful aspects that really happened throughout this project. And so the county teams included members from either the county departments of health, the Department of Public Health, also departments of behavioral health. And we had a few county offices of education that were part of this pilot project. And underneath that umbrella, they really invited other partners to be part of this process as well, which included the emergency response, law enforcement, juvenile justice systems, and also child welfare systems as well. We're part of this nice cohort of partnerships that really provided some of that tailored approach for each of the counties and their communities as well. And so Tina is actually going to start us off with kind of how this journey started with the system flow mapping and really supporting counties identifying some of the gaps and really needs as identifying how the young person enters into their system and how we were able to support them through this process. So Tina, take us through this journey.
Sure. I'm really excited to share with you two, I know Angela called them frameworks, and they are, but they're actually activities that we feel like any county can take and kind of run with. And we're certainly happy to share not only what this process was like, but what are those things that help move the needle or help to really make change, transformative change for these counties, do things differently than they have for suicide prevention and crisis response. So we're going to look at mapping, understanding youth crisis journey, mapping pathways to safety, and I want to show you this visual. So understand that, I think Angela gave you that timeline. What we really had was over the course, a little over a year to really kind of put this together. And it involved a lot of back and forth. It involved a lot of team discussion, widening the net to bring people in, and constant revisiting of this. But what I'm happy to share is, while I go through all of these steps, is at the end of it, this is something that sustains, is still going on, and helping to guide suicide prevention efforts for the counties that are involved, even though this pilot project has ended. So system mapping, many of you have done, right? You're looking at what resources and assets, what community partners you have available within your counties. And that's where we begin. This system mapping process is really about identifying team members as well as internal, external community partners, what we want to do for this community or for the county that we worked with or who we worked with is identify strengths and weaknesses, right? Vision, help to think about what is possible, what are those wishes and dreams you'd like to work on, how do we get there? Generate opportunities. Here's one thing that, and I'll share some of the feedback too, but some of the feedback we got regarding partnerships specifically is we didn't know how to begin the conversations, right? How do we bring them in and talk about collaborative service delivery? Because, like many of you have shared, there's so much siloing happening, but how do we take that? How do we take those silos down? And so it was a lot of creating dialogue, all for, again, transformative change and improved outcomes. Overall, this project, what we wanted to see happen and what the ask was, not only setting goals and visions for this particular county or community, I'll kind of use that interchangeably here, but also identify again commonalities, give them a foundation or framework to work from that shows evidence of their success, and identify future promising practices to be used and lessons learned to incorporate. So step one is really determining who's a part of this, right? And you've done this in other planning that you're doing, is defining who needs to be at the table. Really looking at what is the specific system or systems involved, what boundaries do we have, and initially what partners are committed at this particular point, informal or formal. We set the groundwork for just establishing, again, explaining this process as well as walking them through, and I'll show you the visual in a little bit of what that could look like, but really giving them an idea of what again is possible. In step two, we asked a little bit more. Step two began the process of meeting ongoing. What was helpful to our counties was really being the vehicle for gathering the data, asking questions that hadn't been asked before, or even asking the why. Is this how it is within your county, right? Tell me who's involved. Um, tell me everything from existing not only partnerships, but what does response look like? What do times look like in response? How is data captured? So really the self-assessment are asking such detailed questions that maybe haven't been recorded in certain places. And here's the thing. Angela had mentioned the folks who have been involved in the partnership. There was a core team from the county, and the county teams ranged from one to about five or so regular team members. And for many of them, they came from different areas or different fields. And though they've known each other, there hadn't been discussion about simple systems or, again, data collection processes or policies and procedures that were in place that maybe helped to move things forward or limited what it is that they did. So self-assessment was really getting at and having them see, hear each other's perspective, right? So getting all of those different fields, the departments, divisions, all in a place of answering, what do you do? How do you do it? And who's involved? The third stage of that is with all of this gathered information, we were really lucky to have UCLA generate the initial map. What you'll see in some of the pictures soon is just very basic flow chart of, again, what is possible, what was done, as well as notes of, again, what are those policies and procedures that are limiting or pushing things forward. But the visual was key for counties. This particular visual, again, first time where everybody's information was in one place, we really began to see connections as well as where there were gaps that needed to be filled. And so from the visual, we continued on with analysis. This is the piece where we began to highlight, and you'll actually see the process of from what some may not like with the archaic use of post-its. I love post-its. I still use them. I think they're practical. But you'll also see the projection of, and where we began to have discussions, where there were missing arrows between processes, where there were blanks, where we didn't really know what was happening, for example, in the juvenile justice arena. How were how were youth being served there, and how did they transition back to traditional school systems? What was the involvement and notification processes with schools, with hospitals? And so we learned a lot in this process as far as what those gaps are. What that led us to do, right, through analysis, looking at those gaps and weaknesses, was begin to invite and widen the network. What you're seeing is this progressive build of analysis to really strategically invite people to the table so we can, again, create a more robust system of support and care, where one side of the county knew what the other side was doing, and all of the different divisions who were responding, collecting data, could finally begin to talk with each other or say, let's share information. And so that moved us into community outreach phase number 5, where where amazing things begin to happen. We discovered things like in the medical field. First time we had folks come together in regards to suicide prevention. These are leads and directors of emergency departments, pediatrics, those providing medical services within, again, juvenile justice and institutions, and realizing that they were not aware of everything from syndromic surveillance. What is that? As well as the latest research that we are all talking about within the county. So to bring those folks together, this began, again, multiple networks of collaboration, system sharing, where we discovered things like, from child death review teams to to ER departments, to first responder ambulance data, all of these folks are tracking data relevant to suicide attempt as well as loss of youth to suicide, that we weren't talking. And so connecting them again so that we can share data, work together to streamline care and ensure there's continuity in that care. Finally, that data became again added to and uh, really enhanced the existing system flow maps. The goal of these maps were not only to reflect the work and all the discoveries, but also to continue to bring others in, to share with even from a share to a youth as well as their parent what are the systems involved and what happens to help that conversation about what happens when my youth is hospitalized and what happens after. But it also helped, again, the systems know what was happening because our youth, you know, they don't live, and I'm preaching to the choir, don't live in that bubble. Sometimes they are in traditional schools, and sometimes they're in community schools, and sometimes they are within the institutions. And within that, again, increasing the ways in which we notify, report, respond, and share information, all for our youth and their safety. On the next slide, you'll see some actual pictures of how this process happened. I talked about analysis, community outreach. I know we can't share specifics, but when I talk about the post-its, what you have are folks actually coming together in rooms. And you'll see emergency folks, EMS there. You'll see folks from education. You'll see folks from mobile crisis response for the first time coming together with a purpose of let's look at what we've got. And they actually looked at the information. You can see in initial ones maybe in the bottom left corner. And you can tell if those post-its weren't there. There were a lot of blanks in some folks' systems. And that's not a negative. That invited folks, collaborative partners, to actually add in. And what we turned it into on the next slide, you'll see another picture where, oh, we'll go back. On this one, how much more robust the system flow map becomes. What I want you to draw your attention to, and I know you can't necessarily read it, but you'll see those blocks outside of the diagram or the kind of the chart piece. The blocks thank you to the right and then towards the bottom too. These all capture notes of those details we don't often get to talk about. Things like response time being under 30 minutes or less, or in rural and remote areas, there's the availability or access to helicopters in which to provide support in the event of a suicide attempt. You'll also learn about community collaboratives that are school-based, as well as collaboratives that exist within the first responder world. You'll learn more about who's at the table at Child Death Review Team and what are their limitations. So all of those notes became available and all that information became available to the folks in the room. And people were engaged. So if there's ever a thought of how do we get folks motivated? How do we get the community partners in the room? All of those folks who are committed to suicide prevention all want to see how we can do things differently, better, and support youth a little bit more easily and be able to pick up the phone and now begin to call and say, you know, I know Dana from, and I know Stephanie from, I'm going to give them a call. It increased collaboration, it increased commitment, it allowed folks again to ease that continuity of care. And so I invite you. I know that we've put a couple of things in the chat as well, so that you can actually see them up close. But I think I just want you to sit with and to see the process does work. And again, this is something that's revisited each year. Some bubbles are removed. Some partners, due to funding, due to initiatives, just internal or external changes, become removed, and so we have to update those. You'll see a complicated mix of arrows that talk about, again, attempt versus response or death. You'll see ones that talk about what happens if there's multiple times that a youth attempts. So all of those nuances we think about, we worry about, those are captured in a tool like this. And again, used for discussion, collaboration, and really helping to set goals forward. So I know Nikki has the example there too. I appreciate that. Um, our hope is that in this small, just short discussion, that you're beginning to think about what are or who are those folks we need to include in a conversation. And so what I'd love to ask you to do is we're going to put a Mentimeter here. And so whether it's scanning the QR code or whether it is going to menti.com and putting in that code you see there, we want to know kind of who you are sitting at the table with when we're talking about suicide prevention and crisis response. What we know is in this kind of discussion and this kind of sharing, we've had counties really discover that, oh, I didn't realize this county is talking to their first responder and bringing in, first responders as trainers. Or we've created a communication and notification system that whenever a responder is on site, they now notify the school district and county so that they know there's somebody who needs help that's returning to school the next day or in a week. So please take a moment and let us know, let this group know, who is it that you're working with? Who are those innovative partners or folks that you know can support that you suggest maybe we need to look into, bring into collaborative discussions? But let's take a moment. So please scan the QR code or menti.com. The code is there. And we'll give it just a couple minutes before we share who those partners are.
One of the things about the system flow map that we did is it took about a year process. So initially, as Tina mentioned, we defined the community, but there was like a self-assessment questionnaire that the 10 counties were able to complete. That actual data really helped to create the map. And also each map, we had a template, but each map was customized based on the resources that were provided or the data. And then that really outlined the baseline for each of the counties. And so once we had the baseline, then the TA team or the coaches, they each county had to a couple of coaches or a team to be able to support them in this implementation process. So it was a whole 18-month process for them to be able to, develop the questions. What partners do they need to bring to the table? What gaps are needed, right? So that was a really nice opportunity. So that was on a monthly basis that the TA team was able to provide this coaching, and also did extensive coaching in person to be able to facilitate these conversations with those partners so that they're able to create and outline their final map, because there was like 2 iterations of this, actually monthly iterations, but also the baseline, and then there was a final map that was developed at the end.
Thank you, Angela. And we have got your answers here on the screen. Let me see if I can make it a little bit bigger. Here we go. So who are those folks that you are connecting with, collaborating with to support youth suicide prevention and crisis response? And overwhelmingly, I'm seeing behavioral health, and I'm guessing that is also county behavioral health, law enforcement, absolutely public health as well. What I also want to draw your attention to, and this is where we also learned those nuggets, or we got those ideas of like, let's go ahead and make that cold call and invite local military base and the folks that are supporting families there, individuals and families there. Wraparound and FERS, school personnel, hospital, after school programs. Yeah, I can't say enough about after school program. We have folks there. They're the same kids that are in our schools, and we just have to be sure to be able to include that staff as well, whether it's in training, whether it's in discussions, because they are eyes and ears too. Definitely another call out to wellness coaches, as was brought up by Matt a little bit earlier. And of course, survivors of suicide. If you haven't connected with um, survivor groups, right? This is something to think about to really understand what's available out there. What are, and hospitals too are giving those referrals too. So we want to make sure you're aware of it too. But definitely a lot of the same folks are being used, and a lot of great new ideas of who we can connect with. Medical examiner. a lot of folks don't think to connect with medical examiner or coroner's office, but how important it is because here's what we learn. We learn not only is data talked about and our trends looked at within these particular teams. However, it was definitely a push to look at syndromic surveillance data, which is real-time data and not necessarily waiting on lab work because we know that that could take months and in some cases years to get. And so really working with them and also realizing that they too have their own networks. Each one of these partners have their own networks that we could tap into, not only for partnership and connection, but even sustainability possibilities. So I thank you for participating, and I'm going to share with you the next framework that I think will help our systems or enhance our systems as well. So we'll bring up the slide deck again. Yes, I see Leora. Absolutely. Food banks and after school programs. We know basic needs are absolutely important. And we don't get to talk about a lot of the crisis response support things until we've met basic needs, right? And so, how important food banks are. Absolutely. So, our second strategy that we want to introduce to you, and we'll put the links in the chat as well, but I want to introduce to you this maturity model. Some of you might have an idea of what a maturity model is, a framework to improve systems, and in this case, youth crisis reporting and response systems. But how it came together is our first project was looking at collaborations and partnerships. You just went through a systems flow map, quick debrief. Now we're looking at a maturity model that really look deeper into the minutia, the details of what happens. And what we wanted to look at were the different stages of response. That includes, if you look at the chart here, you have 5 domains in the light blue, dark blue text, including planning and collaboration in regards to suicide prevention. You have prevention itself and outreach. You have reporting, response, and data or measurement or continuous quality improvement, CQI. We divided this because these are not only the stages of suicide prevention, but these were also ways in which we could help counties look at specific areas, assign, and also figure out how to, again, bring in different collaborators and partners within these different stages. So, first, I want to talk a little bit, I want to explain a little bit of these domains and why it's important. Now, let me share that the maturity model is evaluative. And I say that not to scare folks away, but to explain that our counties needed something more beyond just the identification of what we shared with system flow mapping. System flow mapping seemed to fit really well in the planning and collaboration domain, right? Where we talked more about and engage in resource asset mapping, what to do with the information we just gathered, and the identification of new partners and ongoing partners. It was one part of it. Um, but then they wanted more. They wanted to look at, are our campaigns working? What do we need to do differently with our outreach? Again, more into data and what are the systems being used out there. A clear difference between reporting and response as well. So understand that though it is evaluative, the folks who are doing this are the counties themselves. One thing that was different was as they began to widen the net, they realized there are subject matter experts in each one of these areas, and we haven't tapped into all of them. And so they began to invite folks to respond to this survey. It was a survey of questions in regards to the domains, and they were specific to each domain. So different people responding, those who have a higher level who are able to understand the system of response, the system of suicide prevention. And so, again, next level discussions. This framework, the only other thing I wanted to add was outlines various levels of maturity. We looked at our model looked at emerging all the way to thriving. Okay, so there were 4 categories where they self-rated where they're at. Again, with the idea of it would begin to prioritize efforts, funding, initiatives towards whatever was maybe emerging as opposed to thriving. We have that going really, really well. And so again, 4 categories. Aside from that, it helped to optimize data-driven support, guided communities to enhance their responsiveness and their effectiveness in meeting the needs of youth in crisis. Why they did it, I shared a lot of that, but the real goal here of the entire project was to reduce suicide attempt rates for youth as well as reduce the loss of life of our youth too. It brought a lot of clarity as to what needed to happen next. I started with planning collaboration. What you'll notice, I won't read through all of this, but in that first column, you're going to see that the ask was really, how are you doing as far as collaborative discussions in regards to your strategic plan? Do you have a strategic plan? Are you meeting and have a suicide prevention network within your county? Are you attending and do you have a representative at the table? Is youth voice in suicide prevention for youth being heard? And so, do you have a youth advisory board? Um, how are they being assembled? How are they being honored? Um, and you'll notice in every one of these domains, the discussion for sustainability was there, recognizing that you know, mid-year, there were questions of continuity of funding. There were questions of, how do we navigate external changes in policy, administration, and just change in priorities. So sustainability is going to be key for each domain. The second column focuses on things that you were doing as well. Prevention, those campaigns that you create. What do they look like? Are they using guidelines for safe and effective messaging that's out there according to national and state guidelines? Are resources available in and accessible in different languages? Are they available to all populations? Are there other suicide prevention activities and making sure we're tracking those too? So instead of recreating the wheel, folks can collaborate and participate. So suicide prevention activities range from, gosh, art contests all the way to ensuring that public buses had the messages throughout the year, and sometimes maybe an extra push during September Suicide Prevention Month. Reporting refers to, that's a third domain there, refers to um, the most immediate action once we are aware of a youth that wants to or is attempting suicide. And so they really looked at systems of what is being used. What are folks aware of as far as state, local, community crisis lines? Are they connected to or aware of warm lines like NAMI? Um, as far as notification to school, I'm speaking to the choir, but are they connecting with you at schools, at county offices of ed, school districts, and the schools themselves? Is there a fluid system, an expectation or policy created to ensure notification occurs? And are they informing our school-based mental health teams that there is an issue there? Some were, and very many were not. And so looking at other counties who are maybe modeling that or who've already kind of piloted those programs and connecting with them was critical for so many of our counties. With risk response time, again, two things. There's risk response time and then response after the death. We looked at and really discussed, is there a crisis response team once we're aware of a death on campuses, right? Whether that be from the school, the district, or county office of ed. And as far as risk response time from the community, who's coming out? Do we have mobile crisis available? Fourth, for response, looks at both attempt as well as loss of life due to suicide. And so you'll see the discussions were around what is least restrictive. Do we need other departments and do we need to connect ourselves to other departments so that the first instinct isn't necessarily a hospitalization? Or is there understanding in and around intensive outreach or partial hospitalization? And what does that look like for our youth? And so it talks about that. It talks about transition from the hospital back to schools or from schools to hospitals and how to, again, ease the communication there and make sure there's nobody falling through the cracks. And we are absolutely reaching students and families when that crisis occurs. Finally, with data, I mentioned this, it is about data sharing. It is about processes and analysis. But what I'll share is this particular area saw a lot of growth. We learned there were not all counties were using CalVDRS, our state system of reporting suicide. And so, what does that mean for our state data? And also, do they have the capacity, and how do we get to that place where they have the capacity to report? And how to use this data to inform our prevention campaigns? Are we connected to child suicide death teams? Also, you see child and young adult. So many did have child death review teams. Some did not have subcommittees looking at suicide specifically, and some did not have one specific to transitional age youth or young adults. When we know, we absolutely need to know what's happening with them and also provide support because we see less supports in that area. And of course, what is syndromic surveillance? Real time looking at patterns, outbreaks, what is really happening, and how do we respond in the here and now. And thank you, Angela, for putting that in the chat. But that is our maturity model, what we looked at. The I'm open to any and all questions about this, but I think what would really be helpful too is you have access to the actual maturity model guidelines and booklet there as well. Many of you might be thinking, I do this domain really well. And some might say, I don't know what this is and what do I need to become more familiar with? What I'd love to do before we switch gears here is one, open up to questions about either one of these. And let me see if there's any questions in the chat or feel free to unmute.
Yeah, I don't see any questions, Tina, but thank you
Okay.
for highlighting. I mean, this was like, again, an 18-month process of showcasing it in 10 minutes, right? But I think the other piece too is that some of you may or may not be familiar with this maturity model because it's one of its kind. Part of the goal for this particular project was for UCLA to develop this. And then we, as a TA team, were able to support in the development of the domains, and then also had subject matter experts to really highlight some of the areas that needed to be added to this tool, because it's a really cool opportunity to be able to do a self-assessment. And then also it was a nice opportunity for counties, once the project sunsetted, they can continue on to enhancing some of the areas where either they scored lower than others, and just kind of looking at that implementation process for them to improve in certain areas. So this may be new to most of you because it's kind of a new process, but it might be some of you may have experience in these areas as well. Maybe not in that specific like domain or indicators, but all of you are experts in all of these areas. Hope that made sense. Any questions? And thank you, Leora, for adding the actual maturity model template in the chat. So feel free to just kind of browse through it. I know it's a lot of information to take in, but it was such a really cool framework to develop. Matt.
So is my understanding that since El Dorado County was one of your um, participants, that they would have completed that mental model process, and so there is a plan that exists for El Dorado County of going through all of that, and where would we find that?
Yeah, that's a great question. So if you send us, Tina and I, an email, we can connect you to the folks that were part of the leads of this particular initiative. We're happy to connect you. And we also have a sample of it as well, but we can talk and send you all the resources and information for El Dorado. Happy to do that. Okay. You wanted to share the Mentimeter, Tina, this time?
Oh, I can. Sure.
There are no
Absolutely.
questions.
Okay. Let's go ahead and we'll put the slide deck back up if that's possible. Thank you, Nikki. So Nikki's got the Mentimeter right there. If you need to scan it, QR code is available there. What I want to reinforce here is this is not a check of, how well we do. Um, what it is just what are you more familiar with? The idea again, and the whole process from system mapping to maturity model was really just to, it is a vulnerable process. It's one where just looking at where do we want to um, move forward in, where do we want to grow and put our efforts into learning, enhancing, and growing in. And so this particular question um, simply asks, uh, what are you most familiar with the hopes that it guides your process. So we'll give folks a moment to answer that, and then we'll share the results in just a bit. So if you could take a moment to do that, that would be great. We'll give it maybe another 30 seconds. And we'll just kind of see where folks are more familiar with. Thanks to all those participating. Absolutely. And what I want to share is that most of the counties that we worked with were absolutely familiar with suicide prevention, both on the micro and the macro ends of it. They were so many innovative campaigns. There was a lot of training in regards to safe messaging. So you're exactly where I think most of us have been with suicide prevention and crisis response too. Collaboration absolutely is one that was strong for a lot of our counties too. Definitely, they knew who they should be talking to. I think the issue was how do we bring everybody to the table? And so that support was something that we were happy to work with too. And responding too, being very familiar with responding, providing aftercare, ongoing long-term supports were definitely a key for folks. And then definitely too some growth in reporting and even seeing it as maybe a different area of support. And isolating that was something that was kind of a paradigm shift for a lot of us too. Thinking about what needs to happen in the moment. There's that space between prevention and response. That is the reporting and making the call in the moment. So we definitely spent a lot of time there. And truthfully, though, I've come to love data, but it hasn't always been the case. And so data was something that we began prioritizing and became more of a love towards the end of it when we discovered, oh my gosh, everybody has information to inform these systems. Let's get together and see how our systems talked. And so that helped us to prioritize. Let's look at the growth in talking and sharing information through data. So thank you for participating in that. I'll stop share and I'll pass it back.
Thanks, Tina. Sorry, I was writing in the chat that when we talk about data, like I learned a lot about syndromic surveillance and what that means, and actually added that into the chat just for folks to get familiarized with looking at the data, the dashboards, really connecting with lots of the data folks in the county was really, really fascinating to connect with. And so what did we learn from all of this project, right? Lots of different learnings from this particular experience. And then the next slide, it's one of the first challenges that we were tasked with, right? So the 10 pilot counties needed to understand or have a clear understanding of their local youth crisis systems. And I'm not raising my hand, but crisis systems, partners, and then reporting pathways, right? So really helping them to identify that rapid response process within their county. So that was one of the tasks that we were able to accomplish. What do we do about that? So in the next slide, we learned that system mapping builds stronger crisis response systems. Tina give a general overview of what the process looked like for each of the counties to just, we printed out these 11 by 17 maps, and then they became these poster size maps that they were able to just connect with all of the partners and identify some of the areas that are of need and gaps, and really supported the counties in this process. It was actually really cool to see at the we had two grantee meetings for this particular project, and at the final annual grantee meeting, each of the counties were able to present their final map and just kind of talk about some of their learnings. And I think the commonality that we heard that day was really about the partnerships, how important it was for them to learn so many people were doing the same thing, and really breaking those silos was really important to see. It was actually fascinating to have them really just be proud of all the work that they conducted during this pilot project. And then, we conducted very intensive interviews, TA sessions, and really provided that on-site opportunity for counties to be able to create these partnerships and roles and handouts once the project sunsetted as well. So it really decreased the silos within their communities as well. And so again, the impact was really about greater visibility. Not only did we create these giant maps so they can post, actually one of the counties, I can't remember if it was Humboldt County, Tina, that they actually have it placed in their county office, and it's a reminder of them to really just continuously keep reviewing and reassessing some of the programs that they were able to implement, where the needs are, and continue to create that sustainability. Also looking at that reporting process and how a youth enters into their system, and really connecting those gaps, as you can see in the beginning component of the map as well. And it also provided that leadership capacity among county teams. Like the TA teams are actually able to provide that the coaching. How do you access the county teams from other areas to be able to support the work that they're doing as well? And then identifying those gaps and providing some strategies to be able to meet those gaps as well. What was really also cool about this project is that each of the counties had an implementation plan that was submitted to CDPH, and then we as a TA team created very specific TA plans that were customized so that we can help them with this process as well. So each month the TA specialists were able to provide ongoing coaching to support them in this implementation of this. So it was really cool. One of the recommendations that we offered to CDPH in our final evaluation report was that we should be sharing this throughout the state, right? So all of this data and these resources are actually really helpful for all counties to be able to have as a foundational tool for just really looking at their youth suicide prevention and postvention systems and strengthening them, right? So why reinvent the wheel, right? There's the resources are already there. So at this point, I haven't seen anything posted on the CDPH website, but there was a final report of recommendations that were submitted. So as soon as we get that information, we'll be able to share it and place it in the hub. But that was one of our recommendations for this particular area or need. On the next slide, we have another, task or challenge that we were able to complete through this process. Is county teams wanted or needed an orientation on all of the best practice models in crisis response, prevention, surveillance, and rapid reporting. One of the areas that we heard really loudly in our listening sessions is that there's so many tools out there. Which ones should we use? Can you put it into like one location where we can actually look to see what resources are more adaptable to our community? So that's one of the challenges. And on the next slide, one of the lessons that we were able to, process here is that exposure to best practices really accelerate that system's growth, right? So what we actually did is we provided an orientation to statewide and national models. We're going to be sharing some really nice tools and resources in the hub later today for all the different tools that we were able to provide or create for this project, so that it's helpful for you. And then also the other piece too is that we structure this project through the use of topical modules, communities of practice, and skill building trainings. So we had one topical module and then tailored communities of practice as well. And again, we'll talk a little bit about some of those resources that we were able to offer for this particular project. And also I talked about the TA intensive coaching that we were able to provide. Another big key piece, which I think is also very similar to BHSSA, is we want to know what other counties are doing, right? So one of the pieces that we were able to integrate was to actually do sharebacks. And during some of our communities of practice and our topical modules, we actually had each of the counties present on an area depending on the topical module. And that way it's easier for folks to learn. There was a replication process for effective practice, right? So one county was able to share on their crisis response model, and then training and how they were able to connect to that particular piece. And then other counties were able to replicate some of that practice as well. So the impact was really about increasing the understanding of the crisis response. Again, the term syndromic surveillance, really looking at that reporting, right? Because initially the project is really looking at decreasing those numbers of suicide rates amongst their communities. So that was the actual overall arching goal to provide for this particular piece. So what we also did, another recommendation within our evaluation report is we want to be able to share these best practice models and promising approaches, the maturity model, the system flow, the mapping process. That's also very effective for folks and to be able to kind of look to see what resources they have available, what areas they can identify, and how can they best integrate some of these components within their community or their county plans as well. Because each of the counties in the state of California has to have a safety plan embedded. So that was another component also. And then the last challenge, I mean, we have other ones, but the last challenge on the next slide, we know, and we talked about this already, that system change really requires time, capacity, and cross-sector buy-in. And Tina talked about this a little bit, but again, we had technically the grant, kind of was funded for 3 years, but because of some delays in contracting, we actually had about 18 months to really complete this project. And so it was super quick. It was a very fast project. And on the next slide, these are some of the pieces that we were able to integrate into the work, right? So Tina and I were actually chatting earlier that one of the pieces that was really, really helpful where things kind of just sped up, because not only did the counties have to, implement their implementation project, but we also had the evaluation component that was connected to this. And once we actually partnered up, the county teams really saw the TA team not as an external coach, but more like a partner to be able to, navigate through this process together. So it was a really nice, relationship that was built throughout that process. And so we supported them with TA coaching, with tools, partnership and leadership engagement. Like I said, the TA team really went into each of the counties and helped to facilitate those discussions amongst all of the partners to be able to develop this really beautiful mapping for their county systems as well. And then also some of the impacts that we provide or that actually came out of this particular lesson, it's really strengthening that collaboration and readiness for rapid reporting. And one of the areas that we also saw is that because of the partnerships, folks are really excited about the connection. That's what we saw, a lot of like relationship building. There were large systems. I mean, LA County is huge. All of these counties, they're all in different, they vary in size, but there's so many different implementation or programs that are not talking to each other. And during this process, they were able to have these conversations around how to develop these systems for supporting young people. And our additional recommendation was really about supporting, allowing more time for development. In an ideal world, you know, when we're sunrising a project, it would be great to have like a 6 month of like just contract building, because the counties also had their own challenges internally, because they were going to be hiring folks to be implementing some of the work, but they also had some challenges with the contracting process. And so some of them had unspent funds to be able to, because of just the delays in contracting. So ideally, it would be nice to have more time to develop this opportunity and partnership building, especially because it requires, relationships require a lot of time, and then also a lot of, really creating that buy-in for that support. So those are some of the learnings. I don't know if I missed anything, Tina, if you have any thoughts about some additional highlights from some of the lessons learned for the work. Good. All right. Okay. So how does this, some of the implications for BHSSA work, why this is important? All of you are doing amazing work in the community, helping young people, families, not just for school mental health, but just additional, like there's a continuum of support that you're providing. So there are so many different implications for some of the work that we're doing as well. And then the next slide, we kind of highlighted some of the implications for BHSSA work. And as we look at all of these lessons learned, we want to be sure that we're kind of aligning them directly to some of the pieces that you're doing as well. So with the crisis system mapping, that really helped to reduce silos. So this is a consideration for folks to just kind of dive into learning more about the process, really mapping out the pathways, like understanding the roles and responsibilities, who does what, right? I'm sure you already do this work, but it's really, it was a really nice opportunity for us to really see from each of the counties. So that's one of the takeaways that came out of this particular project. The other aspect too is really looking at best practices and using each other for peer. I know one of the pieces we heard a lot through this project again was really about what is this county doing? What are you doing to address this area? How are you dealing with some of these challenges? So it's really connecting with best practices. And again, why reinvent the wheel, right? We don't want folks to start from scratch. There's already really great resources out there. And so it really creates more efficiency. And since the system's already developed, it ensures that quality and also being able to meet that funder expectation because you're using best practices as well. Some other implications for the work that you're doing as well is, I know you can probably relate to some of the pieces within the 10 pilot counties, is that there's a lot of these system change takes time. And so everybody has different capacities and starting points. And so we know that sustainable change really takes that time. So really about creating that durable systems. There's not short-term fixes, but really kind of just leveraging some of the resources already out there, really important as well. Leverage each other, right? So you're here, you're connecting. Matt, thank you for asking, how do I connect with the folks from my county so I can get this information? We're happy to connect everybody with all of the different resources as well. And then also, Tina mentioned this as well, it's important for using or really integrating youth and family into the work that you're doing as well. That's one of the pieces that we discovered in this particular project, the importance of using youth voice and family voice and really center the resources around the work that they're needing or the service that they're needing as well. And lastly, suicide prevention should be trauma informed and grief sensitive. And also, we know that suicide postvention needs our attention. It often gets missed in a lot of the work that we do. And so it's important for us to also connect that through that continuum of support as well. right. So some of the, I'm going to go through this not pretty quickly, but we just talked a little bit about it as well. Is the call to action is the counties in this pilot project really wanted to ensure that they expand their learning across the suicide prevention continuum, especially related to crisis response as well, continuum of care. And so we provided we talked about this already, that we provided a lot of like support through the topical webinars, the skill building. We actually provided culturally sensitive suicide prevention training as well through Be Sensitive, Be Brave. And so really creating that organization around partnerships, that was really important as well. So Tina mentioned some of these also. And on the next slide, these are all the different examples of the resources that we created. We developed an onboarding guide for teams that were actually joining the project. And so a lot of folks needed to have an understanding as far as like, how do we onboard individuals for the youth suicide prevention project? And it's going to continue as well. So we created an onboarding guide. I think the other piece too that was a really highlight of this project was the training catalog to support youth suicide. So we put together a whole list of training that for capacity building for counties as well, with pricing, with like, how to contact, how to become a trainer of trainers. So all of that information is like listed in there as well. And then the other aspect too is the MOU guide. It's really about that partnership development. That was really important for counties to kind of understand, like, how do we create these partnerships, like not only just like a relational piece, but also how do we make it more concrete with developing these memorandums of understanding for the work that they're doing. San Joaquin County, their implementation funding was actually focused on the program focus. So there's we'll be able to list this information out in the hub today, but these are some of the different resources that we were able to develop. Really cool stuff. I agree, Monica, thank you. And on the next slide, as you think about some of these, we had a lot of reflection questions today, but as you think about some of the different resources that we provided, and then also the frameworks, are there any other opportunities or resources related to suicide prevention that would enhance your BHSSA work? So that's something to kind of think about as you leave today, right? So you can share it in the chat, or even a question like, do you have this resource? And we can kind of see we created it. If not, that's something that we'll be curious to learn from you and what you need in supporting you in the work as well. So we're going to kind of close us out. Tina's going to take an opportunity to close us out and think about some of the aspects that you learned today. Lots of information, really cool information, but we're also very happy to follow up with you with any additional questions that you may have that come up.
Thanks, Angela. I will do my best. But on the next slide, you've heard about universal resources. You've seen the different virtual learning. We dove into maturity model, as well as systems flow mapping. Maybe there were strategies throughout the discussion on challenges. But I want to ask you, and I'm going to ask you to do your best to answer the three. If not, give me one. But for thinking about what we've done here, first, I want to share a quote. Small acts, when multiplied by millions of people, can transform the world. What was done in this particular project were shifts in change, discussions, dialogue, and increased collaboration. What we thought we were going to do from the beginning, some of it came to fruition, and some of it we took a different direction, and it still transformed what was done within each county. Changes just a little bit for the professionals involved, as well as the students and families, the youth and families that were part of this. What I want you to think about as you think about the information, the resources you're reacting to, I want to ask you, what do you agree with? What are those things you've heard about today that you've tried or that you would try um, that are practical next steps for you? A second reflection or thought is, what do you argue with? What are those things you don't believe will work, you disagree with, or seem unreasonable, whether that's internal factors or things happening outside of you, your team, external factors that wouldn't make some of this stuff work? What do you aspire to bring to your county? What are things you've heard today that you would like to try within your own practice and within your own county? Agree, argue, aspire. I'm going to ask you too, if you feel like you'd like to unmute and share, please do so. Otherwise, please share with us in the chat. What do you agree with, argue with, and aspire to? Take just a couple of minutes. Love it. Thank you so much, Christian. Aspire Youth Advisement Board, incorporating that youth voice, so important. Absolutely. And how to keep that going. So that's development of just not only finding the youth, but the team to support it, to make sure it continues, that youth stay involved, get into those rooms and spaces where their voice can have that impact. Absolutely. How about others? What do you agree with, argue with, aspire to? And give it about 30 more seconds. Again, all or one. What do you agree with, argue with, or aspire to? Thank you, Monica. Aspire. Youth Advisement Board, incorporating youth voice again, and ongoing commitment suicide prevention council members. Absolutely. Making sure the folks who want to be at the table not only come to the table, but stay at the table. So that ongoing piece, that's sustainability. And Matt, you agree with and are doing this, should be coordinated countywide, right? No more silos. Argue. Sustainability is tough, absolutely. And I think that's something that continues to be a struggle with suicide prevention and mental health. But this is part of why we've come together to talk about this and inspire to have services at every school. Absolutely, in El Dorado County. Vera shares, I hope, and aspire to build on our continued collaboration and maintain accessible resources that empower us to learn, share, and move forward together. Well said. And I have a feeling that this has been an ongoing effort, an initiative for you. So thank you for sharing that. I thank you all for that. And as we move to the next slide, I'll remind folks, keep putting those ideas, agree, argue, aspire in the chat. We want to hear from you. We want to make sure we are framing this information, the resources, all for you in the way that you'd like to see them. So please continue to let us know your thoughts. This is a survey to let us know what you want more of, what you enjoyed, what you didn't, what we want to be talking about. So please be sure to scan that QR code or the links in the chat as well. What I'll share on the next slide, Angela mentioned as well that we will have resources on the hub. We know there are folks who still want to join. There are team members that want to have access to the resources and opportunities and info on the events, follow-up information, archived resources. Make sure you're on the hub as well. Link in the chat. And on the next slide, you'll see the QR code, which will flash real quick. Okay. Make sure you are on that. And then finally, Angela, thank you for making that offer. Please know if this has made you think about one portion of a system flow map or or maturity model or what have you, or you want to make sure you have this training, or you have questions about why does it look the way that it looks, and that's fine too, or it's stirring up some ideas, wonderings, reach out, please. Scan the QR code here, grab that TA request link as well. We're happy to share any and all information with you. And finally, just want to say thank you on behalf of the team, on behalf of Angela and Nikki and Leora as well. Thank you to all of you for joining us for today. And we've ended a little bit early, but able to stick around a bit if folks have questions, comments, or anything else. Thank you so much for joining us today. And thanks for your
Yeah, thank you.
participation.
Thank you, everyone.